Hi guys, I'm Rachel. The other members of our team that are going to speak today on behalf of our presentation are Anna and Madison. Our topic revolves around workplace safety. It can be divided into 3 subcategories. First one being patient safety, second one being workplace hazard, and third one being interpersonal conflict or emotional trauma. Let's see what we can learn today.
So my section of our project is patient safety, which is an essential component of nursing. And how is patient safety relevant to nursing? Well, the bottom line is that patient safety is at the core of nursing care and it's relevant to everything that we do. It's also relevant to nursing workplace safety because the foremost work of the nurse is to ensure patient safety and well-being. So I'll talk a little bit about the Joint Commission, which is an independent nonprofit group which administers accreditation to hospitals and healthcare facilities and establishes standards to guide patient care, medication safety, infection control, etc. And it's by these standards that hospitals and healthcare facilities can measure their healthcare practices to make sure that they are in line with the standards established by the Joint Commission. Annually, the Joint Commission releases national patient safety goals to focus on throughout the year, which focus on particular safety and healthcare problems and how to solve them. So, 2020, the national patient safety goals are to identify patients correctly, improve staff communication, use medicine safely, use alarms safely, prevent infection, identify patient safety risks, and prevent mistakes in surgery. So when we identify patients, we want to make sure that we're using 2 identifiers. And to improve staff communication, we want to make sure that that's not just communication from nurse to nurse, but also between the nurse and any member of the healthcare team, be it the provider, the lab, radiology, nutrition, pharmacy, etc. For medication safety, we want to make sure we're using the 6 rights of medication administration and performing our 3 checks when we administer medication. For alarms, we want to make sure that any patient who is a fall risk has a bed or a chair alarm and that it's functioning correctly and we're responding to the alarm when it goes off. To prevent infection, we want to make sure we're using correct sterile or clean technique as indicated. And to identify patient safety risks, in this context, it's speaking specifically about suicide prevention. So if we have a mental health patient that needs a one-on-one, we need to make sure that one-on-one is there at all times and that we've also removed anything from the room the patient could use to hurt themselves, such as shoelaces or a flower vase or anything like that. And to prevent mistakes in surgery, we want to make sure that the right side and the right site is being operated on. So next, I have a patient safety skit, which I'll have you guys watch, and you're going to be looking for mistakes that I make as a nurse, which put my patient at risk.
Hi, Molly. My name is Anna. I'm going to be your nurse today. How are you doing?
Good.
You're good? I heard that you hurt your leg. Does it hurt?
Yes.
All right. Well, can you tell me your name, please?
Molly. Good.
Molly Dude. Okay, great. On a scale of 0 to 10, 0 being no pain at all and 10 being the worst pain of your life, what's your pain right now, do you think?
Like an 8.
An 8. Oh, okay. Well, why don't I go get you some medication so that we can help bring your pain down, okay?
Okay.
0.5 milligrams per kilogram every 4 to 6 hours for pain, 8 to 10. So I can give her that. She doesn't have any pain medication yet. Let me go do some math real quick here. All right, so I'm going to give her 1.82 milligrams based on her weight. Now, I really should have another person check that for her because she's a peds patient, but it looks like everyone's busy right now, and I'm pretty confident in my math, so I'm just going to go ahead and give this to her. So I've got 1.82 milligrams, so we're going to give this to Mom. Hey, Mom, it's been about half an hour since I gave you that pain medication. How are you feeling?
Better.
You're feeling not a lot of pain right now?
Yeah.
All right, sounds like a good time to check your wound and maybe change your dressing. Okay. So let's just check out this wound. I'll be real gentle, okay? Oh yeah, it really looks like we should change that out. So let me clean it. All right. Let me get you a new bandage. All right, nice and clean. How's that feel, Molly?
Much better.
Awesome. Molly, so I've got your crutches here so that you can walk around safely. And you've used crutches before, right?
No.
Well, you've seen them being used, so I'm sure you'll be okay with them. So I'll leave them over here for you. And then this is your call. Make sure that you press this button before you get up so I can come help you, okay?
Okay.
All right.
So how many patient safety mistakes did you see in this video? Let's check the next slide. There were 9 errors in that skit, and actually probably more than 9. So I never washed my hands when I entered the patient's room, even when I was cleaning their wound. I only used her name to identify her. I never used a second identifier. I didn't have a second nurse verify the pediatric dose, and I didn't do my 3 checks or follow my 6 rights of administration. I did not do a repeat pain assessment when I came back into the room 30 minutes after giving her the med. I just asked her if she was feeling better, but I didn't ask for a number. And I also never did a full pain assessment, so I didn't ask her the quality or the location, just that number to begin with. And when I was changing her dressing, I wasn't wearing gloves, and I also cleaned the wound from the outside inward, so I was bringing all the germs from my hands and from outside the wound into the wound, which is a big infection risk. And I didn't teach her how to properly use crutches, even though she told me she never used them before. And then when I left the room, I left both the crutches and the call bell out of the patient's reach, which puts her at risk for a fall. And then other considerations for her would be probably to use a FACES scale for pain instead of the 0 to 10 scale. Because she's a pediatrics patient, it might not be as accurate to use the number scale. And then she probably should be on a bed alarm because she's a fall risk with that injury to her leg. So that's it for my part of the presentation, and I'm going to hand off to the next person in my group. Thank you.
Hi guys, this is Madison. The topic I'm going to discuss today is workplace hazards. I'm going to go over some common hazards that healthcare workers, in particular nurses, face during their careers and some prevention methods with you guys, but first here's some information to get you familiar with the topic. Hospitals are one of the most hazardous places to work. Hospitals report more injuries than manufacturing and construction industries. Nursing and residential care facilities have the highest rate of injuries. 54% of injuries are strains and sprains, the majority resulting from transportation incidents. Nurses are among the most affected by workplace-associated injuries. So as you can see, this topic is very relevant to nursing today because all nurses are affected by it, and we as nursing students are affected by it during our clinical practice and will become more affected by it as our careers advance. So some common hazards that we face as nurses. Musculoskeletal injuries. These are the most commonly reported injury among healthcare workers. These injuries can be costly to the nurse and to the facility, causing missed work days, medical expenses, compensation, and turnover. We talked a lot about musculoskeletal injuries in class. I mean, lifting patients safely, moving patients, body mechanics, all these topics we learned for a reason, and it's because, you know, a back injury can be the reason that a nurse may leave the field. Infectious disease. This includes pathogens like HIV and hepatitis, which can be spread through needle sticks and sharps injuries, along with other bloodborne pathogens. SARS, Ebola, tuberculosis, influenza, and now, of course, COVID-19 are just a few of some other infectious diseases that healthcare workers need to be aware of and protect themselves from. Using proper hand hygiene and infection control and PPE is really important to prevent these infectious diseases. Drug exposure. Many drugs that are used to help patients can actually be hazardous to others. Drugs such as cancer chemotherapy, antiviral treatments, and hormones are considered to be hazardous. Exposure to these drugs can possibly lead to skin rashes, reproductive harm, and cancer. Nurses and other healthcare workers are at risk for these toxic effects because of their repeat exposure. So something that you might give to a patient could actually be toxic to you, especially if you've had a lot of exposure to it, if you've been giving it to a lot of patients. And some of these medications that are considered hazardous are actually fairly common. Radioactive material. Radioactive material can be used diagnostically and medicinally. Nurses and other healthcare workers may be exposed to radiation repeatedly through X-ray machines, radioactive isotopes, or radionuclides. The toxic effects of these can be acute or chronic, and just as with drug exposure, it also has a lot to do with, the amount of exposure you are facing as a nurse. The reality is that nurses do get exposed to radiation a lot. And assault. Working in a high-stress environment with frequent close contact with patients and visitors can place nurses in a dangerous position when it comes to assault. The majority of assaults have been reported from emergency departments and mental health settings, but assaults can really happen anywhere. As nurses, we work really closely with patients and visitors who are, in a taxing time in their life. They might be under a lot of stress, so that kind of can lead to a situation where violence might happen. Preventative measures. Preventing injury caused by these hazards includes things like use and availability of assistive lifting devices, hand hygiene, PPE, proper training, and compliance with OSHA standards. So OSHA, if you have not heard of it, stands for Occupational Safety and Health Administration. This is an administration that oversees all workplace safety for all working men and women in the United States. They do have things specific to healthcare, and that includes things like the Bloodborne Pathogen Standard and the Needle Stick Prevention Act, which are kind of like guidebooks for employers to help prevent employees' exposure to bloodborne pathogens and sharps injuries. They include things like universal precautions, PPE, exposure control plans, hazard training, and record keeping. When complied with, these regulations can be effective, but unfortunately not all healthcare workers or employers comply with these guidelines. Improper hand hygiene, improper use of assistive equipment, and improper record keeping or reporting can all lead to workplace injury. In conclusion, management of healthcare hazards is constantly changing. OSHA standards continue to evolve, new hazards continue to appear. As a nurse, we are directly affected by healthcare hazards. Learn proper precautions, look for safe environments while job searching, report incidents. Understanding how to keep ourselves and fellow nurses safe from these hazards is extremely important as we continue with our careers. So I'm going to pass it off to Rachel, and she's going to talk to you guys for a little bit about her topic.
Hi guys, my topic I'm going to go over today is interpersonal conflict and emotional trauma. The first topic I'm going to go over, or subcategory underneath that, is the nurses eating the young. Does anybody know exactly what that means, the nurses eating the young? Well, it's kind of how it sounds. It's the more experienced nurses that are generally mean or harsher to the younger, new nurses coming onto the floor. It can start with bullying, name calling, or just overall making the nurse feel like she doesn't know what she's doing, she doesn't belong, or she doesn't know how to take care of her patient. I'm going over this because I think it's really important to know that it's a phase that will fly by, and I think that we all need to be aware of it and just know our confidence and know our strengths and know that we know what we're doing. And when we do get out into the real world and we start juggling 3 different patients, that we just have the confidence in ourselves, but also the knowledge set to overcome anything that comes our way and to never give up. Either way, I've noticed through research that these behaviors mostly, unfortunately, tend to go unnoticed. Maybe it's because the manager is used to this older RN and just knows that it's just her way of caring for her patients and she knows it'll go by, or maybe it's just them turning a blind eye to it because they have too many other problems going on. But I want to let you know that human resources, also known as HR, is a good resource to go to if you do feel like you're getting bullied or uncomfortable. I really do feel like it's important to reach out, although statistics show that not a lot of young nurses reach out when this happens. Unfortunately, they just tend to quit their job and go in the other direction. And I think it's really important that we don't do that, that we stick up for ourselves and we stand together as new nurses, because we will all get through this together. It's important to know that as new nurses, we will face strengths and disadvantages throughout our careers, but together we can overcome anything. The next subcategory I want to focus on is overcoming doctor fears. It can be ultimately really hard to confront a doctor or to call the doctor when you do get into the real world. I think that we can take this time as nursing students to watch our clinical instructors and how they interact with physicians. And as we go back into clinicals next semester, I think it's really important that we start practicing these methods so that when we do get on the floor, we feel a little bit more confident when we call our doctor in regards to our patient. However, when we do call our doctor in regards to our patient, it is important that we have information right at our fingertips, such as our patient's name, the patient's room number, why you're calling the physician, the history of the patient, the health history. It's important to have labs on hand. I think it's really important to have recent vital signs for this patient and also any medications they are on or allergies that they're taking so that you can easily answer any of the doctor's questions efficiently. I also think that it's key that we communicate as nurses. So if I'm a new nurse on the floor, I would think that I would want to ask any other nurses any feedback as to what approach would be best to talking to Dr. Sullivan, for instance, or how can I, without being rude or disrespectful, because everybody's different in how you handle them and talk to them, and I think it's really important that we understand that and that we respect our doctors because they are very knowledgeable. The other subcategory I want to talk about a little is PTSD as caregivers, as nurses. It's inevitable that emotional trauma will be encountered throughout these careers as nurses, and that we can handle them and that we are aware of some strategies. Emergency nurses experience a lot of multiple traumas, and I think that this impacts our mental health as nurses, but if we are allowed to be aware of these impacts and take care of our own health, then we will better serve our patients. And our sanity as new nurses is going to be just as important as taking care of our patients, because they will allow us to take care of our patients in the best light. Thank you for. In conclusion, workplace safety is an important aspect to nursing, and it's constantly evolving. I want to thank everyone for taking the time to watching all of our videos, and I hope that you gain just a little bit of information and knowledge and confidence through all of this. Stay healthy, stay happy, and take care.